Hi, my name is Pooja Patel. I'm a registered nurse and diabetes educator from Toronto, Canada. My purpose with Wellness Chronicles is to provide expert and evidence-based information that is going to help you recognize, manage, and even reverse those diabetes symptoms. Thank you for joining us for the third episode of Wellness Chronicles. Today, I thought I'd talk about weight management. Now, in my last couple of episodes, I mentioned that a decrease of 5 to 10% overall weight will help significantly reduce your physical diseases such as cardiovascular disease, renal disease, insulin resistance, and decrease your A1Cs. So firstly, let's differentiate between BMI and waist circumference. So BMI, which is body mass index, is basically a number that is your height over your weight. So based on how tall you are, how much your ideal weight should be. So now this sounds perfect. This sounds quite logical, but picture this. You are a pregnant woman and who is 5 feet tall and you are 140 pounds. If you do the BMI for a pregnant woman, that pregnant woman will be obese or overweight. A bodybuilder who has a lot of muscle mass will also actually be considered overweight or obese according to the BMI. So what is important to differentiate is BMI versus waist circumference. So waist circumference is basically the fat that's around your belly, so how big your belt size is. So that is your waist circumference. You really understand the distribution of fat in your body. Waist circumference can actually identify abdominal obesity, which leads to different diseases such as cardiovascular disease, heart attack, stroke, high A1C, so insulin resistance, all these different diseases. BMI is an important metric. It's an important indicator for weight for sure. But also, when you're using BMI, so make sure that you're using it together in cohesion with waist circumference. So not only do you know if you're at an ideal weight, but you also know if your weight is distributed evenly across your body. A healthy normal BMI should be anywhere between 18 to 25. A healthy waist circumference should be, for males, should be less than 40 inches or 102 centimeters, or for women, it should be less than 38 inches, which is less than 88 centimeters. So this is ideal for men and women. American Diabetes Association and Diabetes Canada and the IDF, International Diabetes Federation, they have identified these numbers are ideal for Caucasian men and women. So if you are of Caucasian descent, if you are of African American descent, then these numbers are ideal for them for waist circumference. Now, people who are belong to the South Asian community, belong to the Asian community, Latinos, these populations, their numbers are a little bit lesser in terms of waist circumference because they are a smaller people. Now, this brings me to my second point. I want to differentiate between visceral fat and subcutaneous fat. Visceral fat is fat that is deposited around your organs to cushion your organs. So it's good, but not in excess. Because in excess, what you will see, it is detrimental to your health and it increases risk to the development of different diseases. What does visceral fat look like? You can't really see it with the naked eye. It's only visible under diagnostic imaging, so your CT scans or your MRIs. But you do know you have visceral fat just by looking at somebody because they'll have a nice pot belly or an apple-shaped belly. With subcutaneous fat, it's the fat that sits right underneath your skin and you can actually pinch it. It's the fat that our body stores away for a rainy day. It's the fat that we always are working so hard to try and lose, but it's not detrimental to your health. So the outcome metabolic study that was done with 13,000 primary care patients concluded that those patients who had higher amounts of visceral fat, they had a higher risk of hypertension, so high blood pressure, high cholesterol, high insulin resistance, higher A1Cs, and impaired fasting and impaired glucose tolerance overall. They also had a higher mortality rate. So how can you fix this? How can you lose that visceral fat? So the 5 to 10% weight reduction that we talk about, once you do lose that weight, the fatty deposits that we can't tend to see, like the visceral fat, those will go away, and those actually tend to go away much quicker than the subcutaneous fat, than the toning and the leaning out. Because visceral fat actually metabolizes much quicker than subcutaneous fat, and that is through your urine and your sweat. So how can you lose that 5 to 10% overall body weight? Now, of course, your nutrition, your diet really matters, but in this episode, let's focus on exercise. Exercise helps build muscle. Muscle uses a lot of energy. And where does that energy come from? It comes from the glucose that's floating around in your bloodstream from the meal that you have just eaten. The more exercise you do, the more muscle you build, the more glucose you burn. And the more glucose you burn, you're decreasing your insulin resistance. So automatically, if you decrease your insulin resistance, your A1Cs will improve, your blood sugars will improve. The 2-hour post-meal spike that you usually get, it will normalize. So exercise is the key to reducing that 5 to 10%, reducing that visceral fat, and reducing that risk that you have of getting cardiometabolic diseases. So the key to staying healthy, so the key to exercising that I always find and I always recommend to my patients is do something that you're going to be able to stick with. So if you don't like doing some kind of an exercise, let's say you don't like doing cardio, don't do cardio. There are other formats that you can incorporate cardio exercises within your routine. So for example, if you are able to doing high intensity interval training, that has a lot of cardio in it. Circuit training is good. Weightlifting is good. All these things will impact your cardiovascular health. So if you don't like cardio, don't do it because you're not going to stick to it. You're not going to be consistent with it. The second thing that's also really important, other than picking something that you really like, is making one small change at a time and then scaffolding it. Increasing it in intensity, increasing it in time. Diabetes Canada and the American Diabetes Association recommends 150 minutes of moderate to vigorous activity. So this could be anything. This could be walking, hiking, jogging, cycling, going on the elliptical, for example, for 30 minutes. 5 times a week. So that's what it pans out to be. And once you feel comfortable increasing the time and increasing the intensity, I would recommend that you incorporate 2 to 3 times a week some weightlifting. Weight training will build that muscle and help you in the long term in terms of sustainability to keep that weight off. So increasing muscle leads to burning calories. That's what we want. And burning calories leads to decreased insulin resistance, which decreases your A1C and your blood sugar overall. So to decrease visceral fat, along with the exercise, what is also really important is increase your soluble fiber. The recommendation is 30 to 50 grams of soluble fiber every day. And so what that means is having more vegetables, having more fruits, having more whole legumes and whole grains. This will increase the soluble fiber in your diet, and that will help decrease the visceral fat. Another thing that is helpful decreasing visceral fat is decreasing your alcohol consumption. Now, Diabetes Canada recommends less than 2 drinks a day or less than 10 drinks a week. So try to limit your alcohol consumption to reduce that visceral fat overall. The third thing that really helps with decreasing visceral fat is intermittent fasting. I will caution you that if you are a patient who is diabetic and is on insulin or is taking any kind of anti-hyperglycemics, please go to your doctor before starting intermittent fasting or a diabetes educator to make sure that your blood sugars don't drop and make sure that you're doing it safest way possible. The 4 ways in terms of dropping that visceral fat is exercise, so 150 minutes a week, and increasing it in time and intensity over time. The second thing is increasing your soluble fiber intake, so fruits, vegetables, legumes, whole grains, limiting your alcohol to less than 2 drinks a day or less than 10 drinks a week. And the last is intermittent fast. But if you are a patient with diabetes, before starting that intermittent fasting, see your doctor or a diabetes educator to do it safely. So that brings us to the pro tip of the week. So this week, I'm going to suggest to you, don't look at the scale. Because if you are making those small changes and you are increasing in time and intensity, and if you are doing all those right things, it's absolutely possible that you're making progress. It's just not showing on the scale, and that's completely okay. So one thing that I have learned as a registered nurse, as a professor of nursing, and now as a diabetes educator is yes, numbers are significant, but they don't tell the whole picture. What does tell the whole picture is looking at the clinical status of the patient along with those numbers. So if you feel great as a person by implementing those small changes, increasing that time and intensity, then do what you're doing. Don't necessarily look at that scale, because numbers alone don't tell the whole picture. How you're feeling along with the numbers do give you a good understanding of what your physical health is like. So if you're feeling good, you're eating well, being as active as you can, and you feel good, don't look at that scale. Don't be discouraged. Continue with what you're doing. Continue with those healthy habits, continue with those healthy behaviors, and eventually those numbers will fall in line along with the way that you're feeling. It's just a matter of time. So with that, I want to thank you for listening to Wellness Chronicles episode 3 all the way to the end. I really do appreciate it. If you took away any important information with this episode that you could share with a family or friend, please don't forget to share this episode and don't forget to subscribe. It's absolutely free. It helps me create more content that is expert and evidence-based, so that way we can create a happier, healthier community. So until the next time, please stay happy, healthy, and kind.